Cancer is perhaps one of the most feared and misunderstood words in the English language. It is best understood not as a monolithic entity, but as a complex constellation of related pathologies. At its core, cancer refers to a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. If the spread is not controlled, it can result in death. However, with the rapid advancement of medical science, cancer is increasingly being viewed as a manageable condition rather than an immediate death sentence. To truly comprehend the magnitude of this disease, one must delve into its biological mechanisms, the risk factors that fuel its development, and the profound physical and psychological impact it has on individuals and society. Biologically, cancer begins at the cellular level. The human body is made up of trillions of cells, which normally grow and divide as needed to form new cells. When cells grow old or become damaged, they die, and new cells take their place. However, this orderly process can break down. When the genetic material, DNA, of a cell becomes damaged or changed, producing mutations, these cells do not die when they should. Instead, they survive and reproduce uncontrollably. It is this unchecked proliferation that leads to the formation of a mass of tissue known as a tumor. Tumors can be benign, meaning they do not spread into, or invade, nearby tissues. Malignant tumors, on the other hand, are cancerous. They can invade nearby tissues and break away to travel to distant parts of the body through the blood or lymph systems, a process known as metastasis. This ability to metastasize is what makes cancer so dangerous and difficult to treat. The causes of these genetic mutations are multifaceted. While some cancers stem from inherited genetic defects, the vast majority are acquired during a person's lifetime. External factors, often referred to as carcinogens, play a significant role. These include physical carcinogens like ultraviolet and ionizing radiation, chemical carcinogens such as asbestos, components of tobacco smoke, and arsenic, and biological carcinogens like infections from certain viruses, bacteria, or parasites. Furthermore, lifestyle choices significantly influence one's susceptibility to the disease. Tobacco use, alcohol consumption, an unhealthy diet, and physical inactivity are major risk factors worldwide. The interplay between an individual's genetic predisposition and their environment determines the likelihood of developing a malignancy. The treatment of cancer has evolved dramatically over the past century. Traditional methods such as surgery, chemotherapy, and radiation therapy remain the cornerstones of oncology. Surgery aims to remove the tumor physically, while chemotherapy utilizes powerful chemicals to kill fast-growing cells in the body. Radiation therapy uses high doses of radiation to shrink tumors and kill cancer cells. While effective, these treatments often wreak havoc on healthy cells, leading to debilitating side effects such as hair loss, fatigue, and nausea. Consequently, modern research has shifted towards more targeted therapies. Immunotherapy, for instance, is a cutting-edge approach that boosts the body's natural defenses to fight cancer. By stimulating the immune system to recognize and attack cancer cells specifically, doctors can often achieve remission with fewer collateral damages to healthy tissue. Beyond the physical symptoms and the rigors of treatment, cancer takes a heavy toll on the psychological well-being of patients. A diagnosis often triggers a cascade of emotions, ranging from denial and anger to profound depression and anxiety. The uncertainty of the prognosis can be paralyzing. Moreover, the disease can alter social dynamics. Patients may feel isolated or stigmatized, while caregivers often experience burnout. Palliative care has thus emerged as a crucial component of comprehensive cancer treatment. Unlike curative treatments, palliative care focuses on providing relief from the symptoms and stress of the illness. The goal is to improve quality of life for both the patient and the family, regardless of the stage of the disease. Looking to the future, the emphasis is shifting towards prevention and early detection. Screening tests can detect certain cancers before symptoms appear, at a stage when they are most treatable. Moreover, public health initiatives aiming to reduce smoking rates and promote healthier lifestyles are vital in bringing down global cancer mortality rates. While the eradication of cancer remains a distant dream, the transformation of the disease from a fatal diagnosis to a chronic, manageable condition is well underway. Through a combination of preventative measures, advanced therapeutic regimens, and holistic support systems, humanity continues to make strides in the battle against this formidable adversary.